What is Peyronie's disease? What is the cause of it?
Well, actually, Peyronie's disease is an idiopathic disease of the penis. What I mean by idiopathic is that we do not know the cause. But there are some suggestions, there are some therapeutic suggestions that it might be caused because of some buckling of the penis, microtrauma of the penis that causes some hemorrhagia and calcifications in the penis. But as a result, we can say, although we can see it more commonly in diabetic patients, we do not know by now the exact cause of Peyronie's disease. But it's such a disease that, of course, affects the men very deeply because it causes erectile dysfunction, it causes angulation of the penis, and it causes pain.
In which stage of the disease ESWT can be used?
Yes, Peyronie's disease has two stages. In first stage, the disease is just developing, not finished yet, and in the second disease stage, the process of the disease is over, and the patient is with the final situation. So the first stage lasts about 12 months, just one year, and in this stage there is commonly a pain and the other symptoms. And by the literature knowledge, we know that mostly in this first stage ESWT is effective. But on the other hand, we have some other studies that show in the second stage also, I mean by second stage, the stage that we have a plaque, a calcific plaque. In this stage also, ESWT may be beneficial in making fragmentations of this plaque.
What are the physiological effects of ESWT on Peyronie plaque?
Shockwave causes an inflammatory reaction. It increases the vascular system, makes some angiogenesis because of stimulating nitric oxide synthase or stimulating endothelial growth factor. As a result, more blood comes to the region and more anti-inflammatory cells accumulate in this region, and these cause some macrophage reactions. Macrophage is a kind of cell that eats the plaque. So this healing process may cause a reduction in the plaque size. Also, we can talk about the mechanical effect, that the direct effect of the shocks may cause a fragmentation of the plaque and make a reduction of its size.
What is the method for treatment? Is there a standard number of sessions?
When talking about Peyronie's disease treatment, we cannot be so clear as what we talked about the erectile dysfunction treatment, about the sessions, because the sessions are not standardized or not well defined, let me say. Just it depends on the plaque and the symptoms of the patient. I myself perform 2 or 3 sessions and observe after each stage, after each session, about the plaque size, is it reducing or not, and the vascular system is developing or not, and the pain and angulation of the patient. So as a whole, I want to say that it just depends on the patient and the reaction of the treatment.
How do you observe the efficiency of the treatment? What is the follow-up procedure?
I myself observe it with the reduction of the plaque, or I see some fragmentations of the plaque. I observe my patients about the pain scores. Are their pain reducing or not? And of course their vascular systems, is the hemodynamic of the penis is developing or not, getting better or not. I routinely check up them with penile ultrasound examinations, and I may record their angulations. Coming to the literature, we know that about 20 or 25 degrees reduction of the curvature is achieved with ESWT, and about 50-60% reduction of the plaque size, and again about more than 60% reduction of the pain.
Should the patients receive standard medications for Peyronie's disease combined to ESWT?
When we are talking of new treatment modalities, of course, we should always keep in mind that we should always go on with the classical standard treatment modalities. We should not leave them. We should use the standard drugs, and additionally, we should use this new treatment modalities. So, coming to your questions, of course, we have to use the drugs and plus ESWT.
What are the objective results of modus ED treatment for Peyronie's disease?
And those objective results, I can say, reduction of the pain, fragmentation of the plaque, and reduction of the curvature.